HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. The Gruppuso Family Women and Newborn Center is opening their doors in Staten Island. Join the conversation about the options new families will have in our all-new center with private rooms, no bridge or ferry required. Give it a listen.
What do you think your nursing colleagues, your nurse assistant colleagues, what do you think they would say about the benefits of this new space?
They're really excited about everything being private and being able to spend more time with one patient, especially on the postpartum floor.
As we modernize different parts of the hospital, step by step, we see these transitions.
Right.
It would be really difficult just to build up a whole new building with all spaces this way, and I know we can do anything anywhere, but given this opportunity changes so much for the care, the clinical care, and the clinical excellence we always strive to deliver every time, but also that excellent experience, and so much of what you mentioned goes into that piece as well. Do you think a lot will change for our trainees, for our residents who are learning to be you one day, getting that opportunity to do it here in the new Gruppuso Family Women and Newborn Center?
I think that, it's a great opportunity to train here because we serve so much of Staten Island. Some of the Brooklyn population is coming to us as well. With the new building, I think we all believe that more patients are going to come in because more people will want to deliver here. It's new and beautiful and cutting edge. So with more deliveries, we need more trainees, and we love training new doctors here.
Yeah, you mentioned our population that we take care of. Obviously, we're here to take care of all Staten Islanders. That is our first and foremost responsibility, and brings us so much pride to do that. We often say here, and it's one of our catchphrases, that we come to Staten Island University Hospital, we serve our Staten Island community, no bridge or ferry required, but there are those bridges. There are ways to get here. And I think this really will be a shining star to drive attention and drive other communities in and get to see the wonderful work that your team does. Speaking of some of that wonderful work, I know we pay a lot of attention to other things we need and want to deliver. Some of that is around the immediate postpartum care and education. Can you speak a little bit about options for feeding children, lactation, breastfeeding, bottle feeding, and what we try to do here at SIUH?
So in order to promote breastfeeding, we know breast is best and we want everyone to breastfeed if it's possible for them. To promote that, once the baby is born, we put it straight on the mom's chest and do skin to skin at every delivery. And that's great for temperature regulation for the baby and so many other things. Once the couplet is then transferred to the postpartum floor, having the ability for the baby to room in gives the mom unfettered access to the baby. The baby's always at her side unless it's off having a test someplace. And that's really important because you want to breastfeed on demand. And all of our nurses are trained to help the moms get the baby latched. And we have lactation consultant for more complex issues.
Yeah, I'm happy you mentioned that too. I think when a lot of women have babies, they think there's this expectation that they should just be able to nurse their baby as if it was always the most natural, easy thing to do. And we know that there are some struggles that women have. I'm sure some of our women who might be watching this can relate to that. But to understand that our nurses are well versed in lactation, that we have lactation consultants who work in the building to help those who are having a little bit harder time.
And we offer the moms breast pumps too. Some moms can't breastfeed their babies directly because maybe their baby goes to the NICU. So for those moms, we help them to figure out how to use the breast pumps and get the colostrum and the breast milk to the baby as soon as possible.
I love that. It's how we want it done.
Yeah.
Right? It takes a lot of team members to keep all this moving. And I know we mentioned something early in our conversation about having the space to really have everyone there together, but maybe to comment a little bit about how we really think our team will feel about being in this space together.
I think the team is really excited, and I think that they really like some of the ways that the building is set up. Is there's a small nursing alcove between two rooms, so you never have to go too far away from your patient when you need to write your notes or put in orders or anything like that.
Like I said before, we can do anything anywhere, but I think this will really just elevate that feeling of being in an environment that is state of the art, brings the team up, elevates everyone together, and is just that little extra push that will let our patients feel the excellence that they all deserve. When we look to see the next phases of growth in the department, how do you think this building will help promote what we're trying to do for quality and all of the other measures that we look at?
Well, I think that having this beautiful space will certainly attract physicians who haven't been here historically in the past, may pique their interest in bringing patients here to deliver them. And then also like to operate on them in the future or to transition their care to this institution.
Yeah, I think every step that we build will lead to the next step of excellence that we deliver here at SIUH. So you mentioned that some women may need to use a breast pump that they won't be able to breastfeed, and that maybe the baby will need some care. We do know at times, sometimes the mother needs care. When I think about these things, baby in the NICU, a mom might need care, or just sort of general next steps. We know we have a network of physicians to connect both our moms and our babies too, that we work directly with here at SIUH. So maybe speak a little bit of how that connection, when the pediatricians come to see the babies, and how we know that we're connected in with that next level of care for everyone.
So when the pediatricians come to see the babies on the postpartum floor, the rooms are equipped so that they can do their entire assessment at the bedside. Instead of taking the baby out of the room to the nursery, they can do everything right at the bedside with the mom present so that they can watch the whole exam happening and discuss it with the mom the whole way through, so that as questions arise, they can answer those questions. And then everyone is given very clear discharge instructions. So when the baby is discharged, the pediatrician will want to see the baby in 2 to 3 days. And we'll tell the mom, everything will be written out, how many wet diapers to expect a day, how much time they should spend feeding the baby, et cetera, et cetera. For the mom, she will also get her own set of discharge instructions, so stating when her obstetrician wants to see her back. So most of the time that's in about 6 weeks. So if she has any complications like high blood pressure or diabetes, her doctor may want to see her sooner. If she had a C-section, usually within a week, so that they can see that this C-section incision is healing well.
So we talked a lot about what the baby's needs are, what the mom's needs are, but I think a really important thing here is to understand that we know it's not just about the day that someone gives birth. It's about all of the care that follows afterwards and all of the needs of both the mother and the baby. Here, it makes me feel great to know that your team is aware of that whole picture. I think it's good for the community to know. It's not just about that one day you give birth, but all the things that come before and all the things that will follow, the appointments that need to be made, the safety measures, and just raising the health of every woman and baby who comes through our doors. I want to thank you. Sitting down with me and having this chat.
Thanks for having me.
We're all really excited about what will come in this building. We have a fantastic team from our nurses, our physicians, our anesthesiologists, our residents, our ACPs, and the rest who support functions of our building every day. And that will be translated to our patients here. So thank you, Staten Island, for giving us a watch. We're really excited about what will come at the Gruppuso Family Women and Newborn Center. We hope you have a chance to see us here. Have a great day.
HealthWish wishes to thank our special guests, Dr. Nicole Berwald, Medical Director at Staten Island University Hospital, and Dr. Carol Russell, Associate Chair of OBGYN. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.